Yes, welcome today. There is a topic that we didn't do. We're going to do it. We're talking about EKG. EKG is a tool used to interpret the electrical pulses of the heart, and it is used to diagnose heart conditions. We didn't do that. So today we are going to learn about some things. There are several steps for the EKGs that we have to learn. One is the electrocardiogram called electrocardiogram. Electrocardiogram. Electrocardiogram, you said it's used to diagnose. It's used to diagnose heart conditions and several things that uh, the heart undergoes when it comes to impulses and some issues when it comes to heart blocks. Now, EKG, there are specific things that you need to know when it comes to EKG that are so important, that are very important, that are very important when it comes to electrocardiogram. There are several things that you need to know. The first thing that you need to understand on EKG is the heart rate, the rhythm, and heart rate, the rhythm, and the P wave, PR interval. There's several things like heart rate, heart rate. Then we have something that is called the rhythm. The rhythm, heart rate. Okay, let me push this so that people can see well. There is something called the rhythm. The rhythm. The rhythm. And then we have something called the P wave. And we have the QRS complex. QRS complex. Those are the most important things that you need to know when it comes to the electrocardiogram. Let me push this one closely. Some people can see well. Let's see where. Yes, I think there is a bit better. Now, there is when we did the leads. These leads are placed in your chest. These leads are placed in your chest so that you can identify, the QRS complex and the deviation of intervals of the QRS complex is because of the polarization and depolarization. Depolarization, we said, is when the atrial or the ventricles are doing what? Sorry. When the atrial or the ventricles have positive charges. When the atrial, sorry about that. When the atrial and have positive charges that are depolarizing, yeah? Okay. We say when the sinoatrial node depolarizes, it's when the positive charges are getting into positive ions are getting into the cell. So depolarization causes contraction. So depolarization causing contraction comes up with a P wave. A P wave. So when the sinoatrial node contracts, you get something called a P wave. And when you get a P wave, there is a point of rest between P wave and the atrioventricular node. Atrioventricular node. So you have some rest so that the ventricles can take blood, and the atriums can take blood to the ventricles. So that rest, we have the P wave here. After the P wave, we have something called Miss Marie. Oh, I can see you. Welcome. This is I've been consulted with some students to take them through this. So that's why I've come early. It's a short thing on EKG. So after the P wave, you have an R wave. This is an R wave for the ventricles, polarization of the ventricles, which is the R. And then you come down to PQP. This is a Q wave when there is deflection of the atrioventricular node, QR. And then after R, we have the S wave. S wave when it is coming and depolarizing the ventricles to push blood out. So after you push blood out, it will not just stay there. No, there will be a T wave that comes. T wave is the holding on before it relaxes again, it repolarizes again. Thanks for joining in. Hope you will learn something. So in EKG, you will see this. In that strip, you will see several of these. In EKG, you will see several of these that they are like this. We get a good pen. You will see several of P wave, like this. See? This is what you see on EKG when they are placed, when these knobs are placed on your chest. So one thing we need to understand to look up is the heart rate. There is a sixth strip. 1, 2, 3, 4, 5. Continue. Now, I hope everyone is seeing that. Now, what you really need to know about this, you can check your heart rate on an EKG, on a 6-second strip of an EKG that comes with, all these nodes that are pulled, lead 1, 2, 3, all these are bringing some deflection on the leads, some deflections on the leads. And you will see there is AVR, AVF, all those. That's why in that strip, you will always see some lead 1, lead 2, lead 3, AVR, AVF, AVL. You get? You will always see those strips. So you here, when you want to know the heart rate, you count on the 6th strip. You count on the 6th strip. You count the R. You count the R deflection wave. 1, 2, 3, 4, 5, 6, 7. So if it multiply by that is in our strip here we have 7. You multiply by 10 on the 6th strip. Let's assume this is the 6th strip EKG. You get? Let's assume that is a 6th strip EKG. So you multiply by by 10, you get 70. If it is 70, it means it is on the normal side, because the heart rate should be heart rate normal. Heart rate normal is between 60 to 100 beats per minute. So our 60 will be normal. There is something called the rhythm. What is the rhythm? On the 60 EKG, how to get a rhythm? You just get a paper. Like see, get a paper. The rhythm, is it, rhythms are graded with regular and irregular. When it comes to rhythm, we talk about regular and irregular. Regular and irregular. So if it is regular or irregular, what do we say? We say that it you take your piece of paper, this one, you note on the first points. So our you check on the 6th strip, are they matching or are they not matching? If they are not matching, it is irregular. If they are matching, it is regular. So rhythm is either regular or irregular. And then we have the P wave. Is it present? Are they identical? You check on the P wave. Is it present? Are they identical? Or the P wave, the heart rate, we have dealt with it, the rhythm, we have dealt with it, the P wave, you check, are they identical? Are they coming out identical? Because this is P, we check here, this is P, we check here, this is P wave, we check here, this is P wave, this is P wave. So when you check and you see the P wave is coming out, what do you see? What you see is you identify that the P wave is there. So it means the sinus is having a rhythm, because the P wave always talks about the sinus rhythm. The sinoatrial node depolarizing and repolarizing. You check on that. And then you check on the PR interval. The PR interval from here to PR. Now this one, you put a paper here, you check, because it will give you a lead on the problems of the heart blocks. So PR interval you check and you lead here, you check here and here. It should be PR interval always is 0.1 to 0.2. So PR interval. See, you should check on the PR interval. It's always on it should be 5 small boxes. On that QR, on this strip, there are small boxes that are there. So you count the PR between here and here. You should have like small boxes that are how many? 5 small boxes. So 5 small boxes talks about 0.1 to 0.2. 0.1 to 0.2. So we have another one, which is the QRS complex. QRS. This one meaning that the QRS complex means the atrial depolarization. The atrium are contracting. So when you have atrial depolarization, yes. Unaweza chukua kwa mganga, basi nichukulie hapo yote. So the QR complex means the atrial depolarization, and it means the atriums are contracting. The atriums are contracting. No, let's continue. This one gives us another topic. Those are the basics that when you want to diagnose the heart rate. The heart rate you've seen how to calculate the heart rate on the 6 streets. What do? You count 1, 2, 3, the R waves 1, 2, 3, 4, 5, 6, 7, and then you multiply by 10. And then there is the rhythm. What about the rhythm? The rhythm, you just take a paper. The rhythm always is regular or irregular. And then you measure the first. Then you keep on checking. If they are not matching, you know that rhythm is irregular. If they are matching, you will know that rhythm is regular. And then we have the P wave. Always check on the P wave, because the P wave always talks about atrial depolarization. The atrium, the sinoatrial node is working, so it is depolarizing and pushing the sinus rhythm to continue. P wave. So you check, are they there? Are they normal? Are they? So P wave, you check it's there, it's there, it's there, it's there. Safe. And then we have the QRS complex. Are your ventricles depolarizing and constricting to push blood? Check, is it wide or irregular? So there are some, we are talking about several things here that are very important in diagnosis. Those are the basics. So if those are the basics, I want you to check this out. That is the basics. We have talked about the rhythm, which is regular and irregular, and we have talked about which is regular and irregular. Now, I want us to talk about something very important: diagnosing and checking if you can be able to know what is the problem underlying on that EKG. Now, a person has come, and the EKG, that one I try so hard to draw, so that you're not drawing sometimes is a critical thing. Drawing at times is a critical thing. Let me try and draw it. A person has come and you want to investigate some things. So there is, we check on tachycardia. Tachy. How to diagnose tachycardias? How to diagnose tachycardias? It's very important we know how to diagnose tachycardias. It is very important we know how to diagnose tachycardias, and this is how we can diagnose tachycardias. The basic info that we have gone through, there are tachycardias, one with narrow QRS, narrow QRS. And then we have tachycardias with narrow QRS again, but this one, the first one is narrow QRS with regular rhythm, and then we have tachycardias. We have tachycardias with narrow QRS, narrow QRS with irregular rhythm. with irregular rhythm. This is two that are common with irregular rhythm because they talk about greetings. I can see Barbara is there. Barbara, this is today is a bit complex for some students. This is for some students, some medical students. And then we have other tachycardias. We have other tachycardias that are very important. And these tachycardias are with wide QRS. You see, they are wide QRS with regular rhythm. And then there is another one with irregular. So let's check out. We start with tachycardias with narrow QRS, irregular rhythms. Which ones do we have? We have some tachycardias. We start with the tachycardias with narrow, with regular rhythm. You get narrow QRS, but it has regular rhythm. Narrow QRS, but it has regular rhythm. You are looking at that strip of yours, but it has narrow QRS, but with irregular rhythm. You're seeing something like P wave going up, we come down, go to our wave there, the D wave, and then you have the P wave, go there, come down, come to our T wave, P wave, go there, come down, then there, our T wave, P wave. This is a QRS complex with narrow QRS. Seen mostly when you see, look at the P wave. Are they there? We have said always check the P wave. Are they there? Is the rhythm okay? Our rhythm. We have said you check on the rhythm. How do you check on the rhythm? How do you check on the rhythm? The rhythm you not, you check. You check it's okay. And then the other thing is you count this on the 6 second strip. You count 1, 2, 3, 4. For hours we have not completed. You count 1, 2, 3, 4 until where it is times 10. Then you get what? You get your rhythm. But in this strip of the EKG now, it has a narrow QRS. The QRS. And when we say let's get back to the rhythm and you see, we say QRS, QRS complex. The QRS complex should be 0.12, 0.12. At least 0.12 is 5 boxes. You get at least 5 small boxes. But now you have, you know how it is. Those boxes are in a EKG. They are like this, like this, like this, like this. They are like those, and then they are. So you count on your EKG, and you find that the QRS complex is not within the 5 boxes. It is within the 3 boxes. The 3 boxes, that is below 0.12 seconds. That is below 0.12 seconds. It means the ventricles are depolarizing so fast. The ventricles are depolarizing so faster because QRS, it means depolarization of the ventricle. So it means blood is being pumped away from the heart so fast. So you check on the QRS complex and then you check, you see, it has narrow QRS complex. Yes, you know, okay, what might be the problems of narrow QRS with that? You note that it can be sinus tachycardia. You know, sinus tachycardia. But another thing is you check on lead 2. P wave in lead 2. The P wave, these ones that we have posted, They are always on that strip. Check the P wave in lead 2. How is the P wave? The P wave in lead 2, you will see it is increased. P wave is increased in lead 2. In lead 2, the P wave is longer than the others. You get? The P wave is longer than the others. In this lead that you have placed, you check on that paper. If lead 2 is increased, you know the P wave is increased. And then in AVR, the P wave is decreased. In AVR, the P wave is reduced. You definitely know that it is sinus tachycardia with narrow. This one is called sinus tachycardia with sinus tachy. Sinus tachycardias mean narrow QRS complex, lead 2 is increased, deflection is increased, it takes time, and then the AVR lead, the AVR is reduced. So we have talked about sinus tachycardia, and then we have something else. You may find this. The normal is there, the PRX complex is reduced, but if you look at the P wave, you will find a deflection. You find the P wave has a deflection. Now you have looked at your strip so well. But the P wave, and you know the P wave we are talking about atrial depolarization. The P wave is deflected down instead of up. Why is the P wave deflected up instead of down instead of up? It's because this one comes with something called focal arterial tachycardia. Focal arterial tachycardia. You see. This one is called focal arterial tachycardia with fibrillation. You know, fibrillations always are faster beats. They are faster beats. So if it is deflected down, what is happening? It's because the point of the AV depolarization, you will see that it is going away. Look at this. Lead 2 is pointing, the electrical system is pointing away, is getting away from the heart. Why? Because the fibrillations are so fast and they are doing what? When you have focal arterial fibrillations, what does it say? Focal arterial fibrillation says there is a point that is another point that is taking the electrical, like the Kent node that people are born with, and they are deflecting some waves so fast. You know the Kent point, when the right atrium, some people are born with a point producing some electricals, and the sinoatrial node is still producing. So when it is producing so fast and the lead 2 is contracting abnormally, the heart is contracting abnormally, you will find that lead 2 is doing the opposite. It's taking the opposite, the electrical system opposite. When the heart is depolarizing, this one is taking the opposite direction of the electrons. So you find that the P wave, because it's of sinoatrial node, the P wave itself comes down instead of normally coming up. Because when it fires, when the sinoatrial node fires, what it's supposed to do, the P wave is supposed to go up. But now you have a focal point that is producing some electrical system, some focal point that is producing some electrical system. So as the sinoatrial node on the left side of the heart is firing, there is another focal point that is firing. So when these points are firing, the deflection goes the negative. The deflection of the heart that is here, this one brings the deflection to the negative. So that is why you get this deflection to the opposite direction. But remember, we still have our narrow QRS, which means we are dealing with focal arterial tachycardia. You see, one, you check on the P wave. Two, you check on the deflections of the points. You get. The first thing we are talking about today is narrow QRS with regular rhythm. Narrow QRS with regular rhythm. And then you can see that these points, they are normal. The points, the QRS, the P waves are normal, but they are deflected out. That one, no, it is focal arterial. That one, no, it is focal arterial tachy. Focal arterial tachycardia. But we have something else. We have something else that is so funny. You can find something like this. You see this? Some jigsaw pattern like this. Some jigsaw pattern. What does this jigsaw pattern mean? Now, we don't have the P wave, but we have some jigsaw pattern. It means that there is a point in the heart system that is really hitting so fast. Even the P wave is not coming out. This one mostly is seen in atrioventricular return tachycardias and atrioventricular nodal reverse tachycardia. This is atrioventricular reverse tachycardias and atrioventricular nodal return tachycardia. You remember about atrioventricular return tachycardia and atrioventricular nodal return tachycardia. The focal point, the Kent point on the right side of the heart is making let me get this side and explain. Get back to our heart here. That heart. Look at that heart. The Kent point producing some atrioventricular AVNRT. The Kent point producing some firing. The sinoatrial node is producing some firing. So what is happening As this is producing and this is producing, it is completing the circuit. And the circuit is going like this. The circuit is going round, 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 round. But the nodal one, the circuit inside, there is a point in the node that is not working well. So as it fires, the node is going and coming back, and then it is attaching. So the node is having a nodal returning, a nodal returning point, a nodal returning point. So when you check at the ECG, because the point is taking so fast and the tachy is return, that's why it's called return. It's going round and round and round, and this one of if even nodal is taking round and round and round. On your EKG, on your EKG, if you check on your EKG, this is what you will see. On your EKG, if you check on your EKG, you will see something like this. The jigsaw wave here, because it is going and going round, going and going round. So these ones are seen on sinus SVT, sinus ventricular tachycardia, because the wave is going round and round. This is how we diagnose tachycardias. But there is something where your focal point and the sinoatrial node is making a lot of beats very faster. It's making a lot of beats very fast, and then you have a beat that is going so fast, even the machine itself cannot specify. So you get something called like this. You get something like this. This means arterial flutter. Atrial flutter. Atrial flutter, because the rhythm, if you check the rhythm, you may find it is okay. And we say the rhythm is checked through these points. You'll find it's okay. But if you check the PURS, it is there, but it's so fast, notable. But you see, it is sluggish and slanting. It means that is arterial flutter. So we have dealt with tachycardias with narrow QRS, but with regular rhythms. We will next time look at tachycardias with narrow QRS, but with irregular rhythms. That's why I've said, why is it narrow QRS and why is it tachycardias? With you check on the P wave, you check on the QRS complex. It will tell you if you check on the QRS complex, it will tell you if it is regular rhythm or irregular. So today we have dealt with regular rhythm because we have the P wave, although our QRS complex on the sheet is below the 5 boxes, maybe 3. So it means it's beating faster. The normal depolarization of the ventricles should be 0.5 boxes, which is 0.12 seconds. So if it is beating faster, it means the QRS complex will be not wide. It will be anything that is constricted when it comes to QRS complex. No, it is tachycardia. It shows the heart is beating faster. Then we have checked with regular rhythm. We have checked our R waves and we have seen the R waves are regular because they match. Maybe they go on 5, 5, 5, 5, 5 boxes. You see, those are the points that we check. And then we check at the P wave. The P wave, we have checked at it, we have seen the P wave is normal. Get? But the focal atrial tachycardia, because of the focal point, and deflection of the lead 2 in the negative way, we see the focal wave is going down. You get? So this is how we use an EKG to diagonalize. We have started with tachycardia, narrow QRS with regular rhythm. All these have regular rhythm because even if they are looking slantish, if you check your paper and then you count them, you'll see all the waves are same. If you put your focal points and then you check, you see that they are okay. So that is how you can see this patient has tachycardia because of the narrow QRS, but with a focal point or wide focal points are bradycardias. So this one, that is how we diagnose sinus tachycardia. Sinus tachycardia when P is increased in AVR and reduced in lead 2, and then we have diagonalized focal arterial tachycardia with a deviated P wave deflection on the downwards. You get with a P wave on the deflection of the downwards, and this deflection mostly where is this? Now in lead 2, the P wave deflected down. You get, but when you check on the AVR, the right side, AV left, AVR, it is up. So when you check on the strip of the EKG, you look at the AVR, it is up, but on the lead 2, it is down because of deflection on the left side. And then we have seen atrioventricular return tachycardia and atrioventricular nodal return tachycardia that has a very funny because of the returning of the electrical system. It is important to note, this one is just one of it. Tomorrow we are going to deal with narrow QRS complex with irregular rhythm. Let's stop by there today. Tomorrow we deal with narrow QRS complex with the most important thing you need to understand is QRS complex is the most important thing when it comes to diagnosis of when using your EKG on diagnosis. It's very important. The P wave is very important. How to know the rhythm and the rate? How do you know this is a regular rhythm or irregular rhythm? You see, that one I've explained. It's very important. The first things, don't start looking at uncommon things when you get the 6-second strip of an EKG. Start by the normal things. Is the rhythm regular? If is the rhythm regular, yes, it's regular. Is the P wave there? Yes, the P wave shows that the deflection of the atrioventricular node is working. The complex, is it wide, or if the PQRS complex, this, look at the QRS complex. Is it wide or is it narrow? If it is wide, it means it's a bradycardia. The heart is sending signals so slow. But if it is not wide, it is narrow, that is the tachycardia. The heart is beating so fast. Thanks for the day. That was the topic of the hour. Requested to talk to some students, and I know right now they know how to diagonalize a narrow QRS complex and a wider QRS complex. And now they know what is atrial fibrillation and sinoatrial fibrillations. Let's meet at our normal time at 4:30 as we continue with our topic of the day, which is cancer. Be blessed, everyone. Let's meet at 4. Bye-bye.